Chairs are so comfortable. This room is so cozy. Thank you all so much for having me. Let's see here if I can get this going. Okay. So again, my name is Maria-Elena, and I'm really excited to share with all of you today work from a study that I've been conducting with colleagues at UCLA, the research on immigrant health and state policy study called the Rights Study. I'll be sharing with you new analyses from this novel population survey that we conducted of foreign-born Latino and Asian adults here in California. And the goal of the survey was to capture at a population level the ways in which immigrant policy touches the lives of immigrants, and to understand how those experiences might be associated with healthcare access and health status. This study is really motivated, and largely my overall research agenda is really motivated, as Joss mentioned, by desire to understand how our immigration system affects the lives of immigrants. And in my work, I focus primarily on Latino and Asian immigrants. These are the two largest immigrant populations in the US, as you'll know. And in many respects, they're very different. The kind of underlying causes and processes of migration to the US are quite different. Their trajectories of racialization and integration are very different. But at the same time, these are both populations that are currently living in the US under a patchwork of federal, state, and local policies. And this is a patchwork that influences every aspect of their day-to-day lives, their sense of belonging and safety in communities, the types of opportunities they have educationally or in the labor market, as well as their kind of protections as workers, and the extent to which they might be targeted by enforcement and policing. And so really understanding how these policies affect the lives of these two large populations is really important to protecting, promoting their health, and really the health of the nation. So my talk today, what I'll do is really quickly summarize what we know about the relationship between immigrant policy and health, and then just dive into the rationale and sort of the theoretical frame for the rights study. And then walk you through very briefly about some of the methods, and I'm happy to talk more, especially in the Q&A, about sort of how we developed the survey, but then get to our research findings, where we look at how immigrants' direct experiences of policy are patterned and how those are associated with healthcare access and health status. So when we think about immigration policy, we generally think about the federal policies that determine who can enter the United States and what their citizenship status is when they arrive here. There's a whole other area of public policy, which I refer to as immigrant policy, which are the policies that determine the types of eligibility, rights, or protections that individuals have in this country based on their citizenship. These are policies that really determine the extent to which non-citizens have a right to sort of integrate into key institutions, whether it's healthcare or education, and the extent to which they might be targeted by enforcement, which is a federal level policy. So currently in the US, federal and state, and even to a certain extent, some local governments have a huge amount of discretion to enact immigrant policies in different sectors. So we see on the one side, this is very relevant for public health, that jurisdictions, whether at federal, state, or local level, have discretion to extend policies that can advance immigrant inclusion. So in areas such as kind of the health sector here in California, we're at this very exciting moment that we're about to see the rollout of Medi-Cal for all income eligible individuals, regardless of legal status, starting in January, but also in areas like education, access to higher education for undocumented students, labor protections for immigrant workers, and access to things like identification and driver's licenses, regardless of legal status. Jurisdictions also have incredible amount of discretion to determine sort of the extent to which immigrants experience restriction or are criminalized. And so state and local governments have authority to enact policies that require different forms of workplace enforcement. So for example, use of the E-Verify work authorization system, and also have a great deal of discretion about the extent to which local law enforcement agencies may or may not collaborate with immigration enforcement. So overall, kind of today in the US, Latino and Asian immigrants live under this patchwork, and depending on what state they're in or even what county. There's different compositions of these policies that really make up the overall context in which they live. And we know from growing number of studies, there's really mounting evidence that that policy context that immigrants live in is associated with specific health outcomes. And so some recent studies have found that the composition of policies in a state or locality are unsurprisingly associated with health inequities by citizenship. So non-citizens living in a state with more restrictive criminalizing policies have less access to healthcare and worse outcome on some indicators.
Can I just ask about the kind of policy context here?
Yeah, please do.
Aren't these intentional policies by states? And so that if the outcome for the targeted group is worse, isn't that the intention of the policy? I mean, how are you trying to, right? Who are you trying to convince?
In terms of who am I trying to convince?
Yeah.
Well, I think right now, a lot of what we see with the policy making is it's political in nature. So I think a case example of this is Arizona, which about 13 years ago passed a pretty high profile omnibus policy called SB 1070 that was largely understood as both kind of an immigrant attrition policy, trying to sort of push out undocumented immigrants, but research that sort of looked into the impetus for that policy found also sort of motivations of sort of establishing kind of racist structures towards the broader Latino population. So what I'll actually get into as I sort of set up this study is that a lot of the current research on immigrant policies has really treated the enactment of policies at, whether it's state or local level, as a political move by policymakers to sort of set the overall tone, not just to target the kind of key population, but to actually create a climate that potentially is either inclusionary or actually quite exclusionary and even overtly racializing. Does that kind of answer your question?
So if these kind of unintended effects is what you're.
And I would venture, and I don't get into it here, that they're not always unintended. They are the spillover effects or the chilling effects that have been documented, which is why in some of the studies that have been done, they've actually found inequities in health by race ethnicity. And so, for example, in one study, states that had more restrictive policies, Latinos, regardless of citizenship, and actually they used BRFA's data, which doesn't even have citizenship, but Latinos as a whole had worse mental health than their white counterparts. And so I'm not a political scientist, but sort of the lens that I bring to thinking about these policies is certainly that there's the sort of target population of the policies, but there's a broader kind of like political intent in terms of shaping the social environment of the state.
Thank you.
Yeah, which is, I think, it is an important part of thinking about and measuring these policies, right? There's sort of who's affected, and then also broadly, sort of how does this shape the environment people live in? Which actually really actually brings me more directly now to focus on who are the populations that are directly affected by these policies. So on the whole, the research that's been conducted has treated policy as sort of this contextual measure. And presumably, and sort of the hypothesis behind a lot of population health research on this topic is that when a policy is in place, it shapes the social environment, and then presumably people are going to experience different mechanisms of either barriers to material resources or mechanisms of chronic stress. And so we know from extensive ethnographic research that's been done by scholars on the ground in different communities that indeed these policies have direct targeted impacts on certain populations and then sort of more spillover effects on other populations who aren't necessarily targeted by the policy. What this means, though, is that we actually have very little population knowledge on the implications of these policies for immigrants' day-to-day lives. Qualitative research tells us that these policies have direct consequences, whether it's having been racially profiled or you're self-deported or being denied access to different rights within the healthcare setting or in the workplace. But at a population level, we don't really actually have a good picture of what that looks like. And sort of what I was sort of referring to, Josh, in my response to you, is that a lot of the research right now really thinks about immigrant policy at a contextual measure level. So sort of what policies have been enacted by state, methodologies have used coding of states or time analysis to sort of think about the point of implementation of a policy. And most population health surveys don't have information about how policies have touched people's lives. And so this gap was really the motivation for the RIGHT study, to sort of take an approach to think about how can we actually measure the consequences of these policies in the day-to-day lives of immigrants and understand how that potentially is linked to health, and really kind of trying to disentangle a little bit kind of the spillover or chilling effects from sort of who's actually directly targeted and harmed by the policy. I'll take a moment, see if there's any. Great. So my colleagues and I launched the RIGHT study really with 3 goals in mind. So the first was to develop and conduct a population-based survey of Asian and Latino immigrants that would capture their experiences of policy. The second was to actually try to understand the patterns of how those experiences unfold. And so, given what we know about the patchwork of policies that people live under, it's likely that no experience would sort of exist in a vacuum, that there would be co-occurrence or intersections of different types of policy-related experiences. And then finally, to understand if those experiences, those patterns of experiences, are linked to health and health status, healthcare access and health status. And so in doing this, I'll talk a little bit right now just sort of about how we've set up the study and then dive into the analysis. One of the key things has been to really think about how to ensure that each stage of the study is informed by theory. And so the sort of original proposal and sort of thinking about different structural theories of health has guided its development. And for this analysis that I'll be sharing with you today, I specifically use Ruth Wilson Gilmore's definition and kind of concept of structural racism to think about how it is that policy, which exists at the structural level, can translate into immediate lived experiences for individual immigrants. So her definition of racism is that it is a limiting force that pushes disproportionate costs of participating in an increasingly monetized and profit-driven world onto those who, due to the frictions of political distance, cannot reach the variable levers of power that might relieve them of these costs. And so this lens is a way to think about how policies enacted at the state, federal, state, or local level translate into immediate and direct experiences of exclusion. And we know, sort of given the whether it's the intent or the immediate function of policies, that federal and state immigrant policies can lead to a range of different day-to-day exclusions. And so this can be the direct denial of public benefits or other welfare or social service benefits or resources, barriers to education, exclusion from the labor market due to legal status, and exposure to worker rights violations, and surveillance and policing from either local law enforcement or immigration authorities. And so all of these sort of represent sort of those immigrants who experience these direct consequences, represent essentially their disproportionate burden living under the policy context. So to try to take kind of this concept and turn it into an actionable survey, our team developed a framework to sort of think about how policy, again, at that structural level, might have immediate individual level consequences. And so we developed a framework that really thinks about sort of the different ways in which policy manifests in people's lives. Sort of at the higher level, there's sort of just perceptions. Again, this could be what sort of drives chilling effects or spillover effects. A person isn't necessarily directly targeted by a policy, but the fear of or the potential consequences of have actual real material consequences for their health. For the data that I'll be sharing with you today, we focused in more on how the policies might directly manifest in people's day-to-day lives. And so across the bottom, I indicate sort of the different public policy sectors that we're most interested in. These are areas where lawmakers have discretion to actively exclude or include non-citizens. And we think about specifically sort of the different ways in which people might either have direct contact with institutions or individuals, agencies implementing policy, or might react as a result of sort of seeing policies. And so we have sort of the idea of acting within policy. Maybe this is really what we talk about when we think about like avoidance. So for example, in the last couple of years, immigrants avoiding public benefits because of public charge. And then more directly, we have both observed and direct experiences where people directly confront and have contact with a violation either of their rights or being targeted by a restrictive policy. So I'll get into some of the examples, but like one example is wage theft, right? Their rights as workers have been violated. So we took this framework and through a collaborative process, which I'm happy to get more into during the Q&A because this was lengthy and complex and involved community input and kind of multiple different stages of literature review and reviewing validated measures and piloting and cognitive interviewing. We developed a survey of policy exclusions, which were 23 different questions asking people directly if the exclusion had happened to them. So sort of moving away from some of the more perception or attitude related questions to really like, did this happen to you? Yes or no? And we fielded this survey leveraging the existing infrastructure of the California Health Interview Survey, which I'm sure a lot of you are familiar with. It's the largest state-based health interview survey in the nation. And it's fielded to about 20,000 California residents each year. So we were able to use our survey sort of as a follow-up. Latino and Asian foreign-born adults who responded to CHIS were able to then be invited to participate in the rights survey. And it was ultimately a 15-minute survey that we administered in multiple different languages from 2018 to 2020. And our final sample was 1,000 each of Asian and Latinos. Yes.
Yes, I have a quick question about your sample base. So there must be a lot of immigrants who refuse to answer government surveys because of their perception of possible consequences. Would that create a bias in your?
Really great question. So a couple pieces to this. So one, the folks at CHIS have been doing research kind of tracking this over the years. And because it is university affiliated and not explicitly government affiliated, they have not seen the same kind of resistance as you might experience with, like, for example, the 2020 census. And so they've been able to do some analyses sort of looking at not just sort of participation rates, but then people's accurate reporting about their legal status. And on the whole, there's high levels of participation and accurate reporting. So it does ask about, for example, not having a green card. They don't ask directly if someone's undocumented, but they do ask sort of a series of questions to establish that they don't have a green card. So that's one piece with the CHIS. Overall, though, however, this is a major problem across the US. And consistently, I mean, pre-2016, there has been a consistent reduction in Latinos as a population, not even just immigrants, participating in population-based surveys. And so it's sort of, I would say, something I'm very concerned about, especially thinking about the quality of data for looking at these populations. Overall, it sort of has been a national trend. CHIS is doing a pretty good job, all things considered, and it being a university affiliated survey has been helpful. One thing I can tell you is I was shocked, but we had 23 questions. We had 100% response to all the questions. I mean, that's like unheard of. Our perception questions, so we did ask questions about perception. Those had people did not respond to some of those, but the direct questions, we actually had 100% response. Yeah. And I think these are like pretty important issues. I mean, it's challenging to sort of think about asking these types of questions. So for the study that the analysis I'll present here, what we did was we took the 23 survey items and used all of them to conduct a latent class analysis to have an independent variable. And I'll walk you through that in a moment. But this sort of just gives you a sense of the types of questions. So we asked about worker rights violations, workplace injuries, labor market exclusions, surveillance and avoidance of police and law enforcement, deportation. And all of these are sort of capturing different ways in which that policy context can manifest in people's day-to-day lives. And I'll get into that LCA in a moment. And so our dependent variables are 4 different outcomes that we pulled from the CHIS. So essentially everyone had already responded to CHIS. We were able to add our survey and then merge the 2. So we had information about whether or not they had a usual source of healthcare, if they had delays in healthcare, their self-reported health, which is just a very, in public health, a very generalized measure of overall well-being that's well validated as being related to other kind of more clinically diagnosable conditions, and then psychological distress, which is also a generalized measure of mental health, not a clinical measure. Yes.
For the 2020 data, when was the field work taking place? Because that's COVID,
so it was right in the heart of, and it was really interesting because I, at the time, was like, we need to stop. This is not okay. But CHIS was still in production, and it was done, remotely. There was no face-to-face interviewing, and crazily enough, because so many people were home, they actually were getting responses faster and actually getting more. CHIS as a whole overall was getting better response rates during that time, and I think it's because it was the lockdown and people were home. The ethics of continuing this type of research during a crisis like that, I'm happy to discuss further. It was odd, and I was uncomfortable with it, and in the end, it was like, oh look, we actually completed our sample faster. So it's a great question. I won't get into the covariates, but happy to just sort of discuss what we control for. These all came from CHIS. So let me walk us through the analysis. So the first step was just to look at these 23 survey measures. We wanted to get a sense, kind of what are the patterns of how immigrants have experienced the policy context. The second step was to conduct a latent class analysis to understand how those experiences sort of group, to sort of identify groupings of immigrants that are really sort of categorized based on the ways in which policy has touched their lives. And then finally, we conducted regression analyses to see if class membership was associated with the health outcomes. So I'll take a moment here on the descriptive analyses. I think they're kind of cool, and I know it's not, technically fancy, but these are some of the first population-based measures that we have of these types of experiences. So first, we have the health and social services exclusions. So we had series of questions focused on different forms of denials. In California, immigrants have a lot of rights to these social service benefits and resources. So a lot of these questions were really about like being denied your rights, not necessarily being targeted by a negative policy. But one of the key findings we developed a question that was specifically around public charge. We called it avoiding government programs, and I can get more into how we established the wording for that. But we found that 1 in 4 immigrants reported ever having avoided a public benefit that they were eligible for over concerns of immigration-related consequences.
Just so I can understand, are some of the exclusions legal in the sense that, say, an employer is denying you employment because you're not a citizen? Well, that's kind of the law for the employer, and some are, I don't know about the government asking to see a social security number. Is that a distinction that you're trying to make, or that you're not trying to make for a specific reason?
Yeah, so some of these are legal, and it's not a distinction that we're trying to make with the survey, and in part because it's sort of thinking about how we define sort of the implications of policy, sort of the direct implications. And so for some people it is, you can't get work, and that's, a direct.
And then your population is not only undocumented people, it's also people who were born in the US.
No, only foreign born.
Only foreign born,
Yeah.
but it's a mixture of people who are here legally and not legally.
Correct. And people who have documentation status or are naturalized at the time of the survey, but who potentially have lived here in the US at times without outside of status. Yeah. So it's a pretty heterogeneous group.
Related question. So is there like a component to these questions, like with a certain year?
Great question. No, we had to go with, given the length of the survey, just did this ever happen to you? We have a follow-up survey. Each of those was a follow-up question of, did this happen in the last year? So we do have that data, but for the kind of overarching thing, it's like, did it ever happen to you? And if it's yes, then in the last year.
Yeah, I just thought of that question because as you're talking about how legal documentation status changes over time, these experiences structurally should change, but they may not, Depends.
Exactly. They may not, and the implications of it having happened to you at an earlier time when with a more vulnerable status might carry forward, which you'll see in a moment here. And so then a range of the measures, I'll go through these a little bit more quickly, really looked at ways in which immigrants might be denied access to benefits. So, citizenship, 1 in 4 had been denied benefits due to citizenship, which again, to Josh's point, is sort of legal again, but a direct encounter sort of like hitting up against the bounds of eligibility and inclusion of immigrants. We also looked at education, which I'm actually just going to go over really quick because those questions did not work very well, but we've stuck with them to a certain extent. And then we looked at labor and employment exclusions, and actually, so this is Josh was anticipating ahead of kind of what some of the questions looked specifically at labor market exclusions. And so, for example, we looked at, was your work authorization ever at risk of expiring? Given things like TPS and DACA, which have been really in question in the last several years, we were interested in that. But also sort of trying to get more generalized ways in which immigrants face exclusion from the labor market. And a lot of these are the wording of them, right, sort of developed as we did the piloting and cognitive interviewing of sort of capturing these constructs. And then we also had questions about worker rights violations. And so, 15% of the respondents reported ever having had wages not paid for work done, which is wage theft. And then finally, we had questions about immigration and law enforcement encounters. And I'll highlight here a couple of, I think, key things. First, overall, about 1 in 3 respondents knew somebody who was deported. So overall, very few, about 5% had ever themselves been deported, which is actually pretty extraordinary given that most people who are deported do not return to the US. So I think kind of from a clinical perspective, that's substantive, but again, not nearly as high as just the extent to which people know people who've been deported. And then also there was a relatively high level of sort of just general surveillance. And so almost 15% of respondents had ever been stopped by law enforcement, which was our racial profiling question. And so kind of there's the extent of sort of these contacts, right, with the policing and enforcement system. So I'm going to see here, jump into, and if you're interested, we have some papers out with some of these different, looking at some of these different areas. Yes.
I have a question, just in future rounds, could you focus on all foreign-born in CHIS? Because you were just pointing about, maybe racial profiling with police. There could be, European immigrants or and
so
their experiences. I don't know how different or similar. Maybe I don't know. Maybe Polish immigrants know people who were deported. Too,
I think that would be so interesting. So I actually don't know what the status of this is, but at the time that we were doing this, the California Endowment was very excited, and they had some money that they wanted to give CHIS to add some of these questions. And so I know that they paid CHIS to ask the public charge question to all respondents. And I don't know which ones it was, but they added a couple of the, I don't own those questions, so I can't tell you the kind of what came of it, but I think that there are some questions as we kind of continue to work with these data and sort of refine which of these questions are really kind of helping us the most. There's opportunities for integrating them into larger population surveys. I think all 23 is excessive, but getting insights into what might work, I think would be really exciting.
Yeah, I was just curious, did you do any stratified analysis or analysis by type of documentation status a person has or racial group? Or you might be getting to that.
We have. So for these analyses, I won't because we weren't able to do it with LCA. We actually have for a couple of papers that we have here. There's another one that I didn't put up here where we were looking at the enforcement experiences. And really surprisingly, because it was one of our original hypotheses that we would see differences between Asian and Latino immigrants. Once you look at an interaction between race, ethnicity, and experiences, there's no difference. Mm-hmm. And at first we were like, wait, this is not what we expected. But when we step back and we realize, wait, these are kind of all of these different experiences are what makes up immigrants' sort of kind of racialization and categorization into race and ethnicity. And so what we realized is that I think what these measures are getting at is not necessarily race ethnic categories as we label people, but the experiences of being in those race ethnic categories. And so on the whole, Latinos might be more likely to experience like deportation, but if it happens within an Asian population, has the same impacts on health.
Yeah, makes sense. I was just curious about like what that breakout would look like in terms of like, actually experiencing it across.
Oh, yes, we do. I do have that. And if we have time, I brought those slides. Because yes, I do have that. I'm happy to show those in slides. So the next step was to take all of this data, and this is where we kind of get into the fun analytical part. It was really to try to understand, okay, there's all these different experiences. What are the patterns of how people are living these experiences look like? And latent class analysis is a great tool to be able to do this. It's a way of really identifying groupings, and a little bit to Jenny's point, it's kind of going beyond race, ethnic classifications or citizen, non-citizen classifications to actually try to categorize people based on patterns of kind of shared lived experiences. And so it's really thinking about kind of the composition of exclusions that people have experienced and sort of similarities within the population, and to the extent to which that might be associated with health. So we conducted a latent class analysis, testing different numbers of classes, and established, my slides are a little bit out of order now, I realize. Essentially finalized that there were 6 classes total that best sort of described the patterns across the sample. And I'm going to skip over that for a second. And what we found with these 6 classes were patterns in which about half of the groups, kind of groups A, B, and C, were defined as largely having had exclusions in health and social services, in addition to some other exclusions, either in the workplace and in terms of like legal status barriers to employment. Almost a third of the sample really only had employment and enforcement exclusions, and one group had exclusions across all the different areas. So I'm going to walk you through this in sort of a visual way, and happy to talk about each one of these. So what latent class analysis does is that for every single one of these survey items, it gives you a probability that members of that class had experienced that exclusion. So people could have had maybe like a 5% chance of having that exclusion. That's considered low. That's actually what this slide was back here was supposed to be. So for members of a class, if they had over 70% probability of having that exclusion, we considered that high probability, and that those were experiences that largely defined that group's overall experiences. Medium fell between probabilities of 0.7 and 0.4, and then anything under 40% is really considered low. Members of that class really probably had not had those experiences. So to walk you through this, I've done something visually. Across here along the y-axis are listed each of the individual exclusions. In the light green are, and then the yellow bars shows you the probability that any class member had those experiences. In the light green, you'll see our low probabilities. In the kind of mint green are medium probabilities, and in the darker green are high probabilities. So I'm going to walk you through each class, sort of giving you a profile of the types of experiences that each group had. So for class A, this is a group that was their main experiences was being denied public benefits. What you can see is that they had high probabilities of health and social service exclusions, but essentially low probabilities of exclusions in any other areas, right? Class B were those who were denied public benefits and also who had some employment or labor exclusion. So you can see there, they have high probabilities here of being denied benefits, and then also some high level exclusions here, having settled for jobs that paid less or being unable to apply for a job due to legal status. And in a sense, I would sort of define this group as really sort of facing economic barriers, either because of lack of access to public benefits or because of poor job opportunities.
Sorry
Yeah,
about the question, this is so interesting.
Yeah, no, please.
Do you think there's anything like that these classes are just capturing different types of immigrant trajectories or like reasons for coming or like pathways to come to the US in the first place? Because I saw the other one had a 70% denied benefits because of income. That could be high income, right?
Mhm.
So I'm just thinking of different legal pathways that could have
Yeah, that's interesting. Potentially, I think one of the challenges with doing work with immigrants in California in general is that the populations have been here for so long that for some of them, right, they're adults maybe in their 30s, 40s, or 50s, but they've been here since they were 20. And so like all of their labor market experiences have actually been in the US. And so I think that sort of muddies it a little bit in terms of trying to think about migration trajectories as tied into this. But I think that's a really interesting idea. Yeah, that'd be interesting to look at sort of those stratifications.
Because we have about 5, 6, 7 minutes more.
Okay, great. And so the third group is those who are also denied public benefits and have a medium labor exclusions. So I'm going to jump into the last two groups that I think are ones that I want to highlight, and you're going to see in the regression analyses next. There was this one group that made up almost a third of the whole sample that had really sort of medium levels of labor exclusions and enforcement exclusions, and almost no exclusions in terms of public benefits. And I would say this is probably a group that perhaps just has not had much contact with the health and social safety system at all. But so they're sort of the way in which they experience policy is largely driven by labor and enforcement. And then the last group are what we call the cumulative exclusions group, had high probabilities of exclusions across all of these. This is about 5% of the sample altogether. So taking all of these 6 classes, our next step was to conduct regression analyses to understand whether or not membership in a class was associated with different health outcomes. And so we used the Balk, Kroon, and Hagener's, it's called the BCH approach, which basically allows us to recalculate the classes simultaneously to doing the regressions. Unfortunately, this limits, so for example, we can't track interactions in this type of a model. But it still gives us a sort of a sense of how are these classes kind of controlling for the classes associated with the outcomes. And what I will do right now is walk you through each of those models, and then we can wrap up and discuss. So in this, I present here for you just the healthcare outcomes. What you see along this column here are each of the 6 classes. The first column is the odds of having a usual source of care. And the last column is having delayed needed care. Both of these are questions asking about what has happened in the last year for respondents. And what we see here is that the 2 last classes, the group that had employment and law enforcement exclusions and the group that had cumulative exclusions, had much higher odds of having delayed care and much lower odds of having a usual source of care. And so we sort of see a pattern in which the groups largely defined by their exclusions in the healthcare setting actually don't have much differences compared to the reference group, which is those with few exclusions. Oops, I'm clicking the wrong way. There we go. And then when we look at distress, we see that the group that has cumulative exclusions has a higher mean distress score than all of the other groups in comparison to the reference group. So this is distress in the last year, which presumably would be sort of an underestimate of potential mental health impacts because it's just looking at the last year. But we still see, even though these are exclusions and it could have happened at any point in time, we still see a pattern of higher levels of psychological distress in that group. And then finally, self-rated health. Because it's an immigrant study, there's always a paradox. We actually found that the group with cumulative exclusions had higher odds, higher risk ratios of reporting excellent health compared to those that had no exclusions, which I'm excited to talk about because I think these paradoxes often pop up for us. And I think give an opportunity to sort of think critically, both about the measures, but also what's happening within the population. So I will kind of sum up what I think is the 3 takeaways from these regression models and some from the overall study. So overall, the survey itself, this like novel population data really gives us a picture that high proportions of both Asian and Latinx immigrants have experienced direct consequences of policy, right? So kind of beyond thinking about chilling effects or spillover effects, there is a need to sort of understand the life experiences, which some of them very traumatic, some just thwarting longer term opportunities, how those affect the health of this population. The second is that the light and class analysis really reinforces for us that different consequences of policies emerge as different patterns across the population. And particularly, there are intersections of people experiencing multiple different types of exclusions across different sectors in different areas of their lives. And particularly for those who are in the class that had limited employment opportunities and had experienced the impact of enforcement, and those who had had cumulative exclusions, we see some of the worst outcomes. So where to go with this and sort of some of the key implications. One interpretation of these results is that the impact of exclusionary encounters likely functions cumulatively on health. And I know there's some exciting work kind of on life course perspective, thinking about legal status as legal statuses change. But largely sort of the immigrant policy literature has not really kind of dove into thinking about life course impacts of the cumulative exposure of these policies. The second is really to think about the intersection and the interaction of exclusions. Often we focus in on specific sectors. I know in public health, we might look at, just healthcare. In other fields, maybe just labor. And there's a lot of research right now looking at enforcement policy. That sort of siloing of public policy sectors might be missing a bigger picture of patterns in which people who experience the harms of policy in one area are likely being touched by the consequences of policies in another area. And then finally, a takeaway for me, and I think important in terms of thinking about where to put our focus in this area, is that that there's evidence from these findings that exclusions related to labor and employment and to immigration enforcement may be sort of driving mechanisms of health inequities within immigrant populations. And that deserves important intention. So I will leave it at that. I have a little bit of information here about some of our work on to sort of disseminate this, but I'll leave that for Q&A. And then I just want to end with an acknowledgement of my former mentor and colleague, Steve Wallace, who passed away kind of just a couple of years ago, right in the middle of all of our work on this study, and who's here with us today, always in memory. So, okay, excited for some questions. And I do have some supplemental slides with some of those breakdowns people are interested in, but
Great. So the floor is open. Emily?
I'm going to sit down because it's weird to sort of be standing on this.
So thank you, that was really interesting. It's not my field at all, but the question that came to mind is, would you consider in a follow-up, which is sort of a follow-up question from someone else, to also consider a sample for comparative purposes of poor white people and of Black?
I think that would be really interesting.
Because some of the discrimination is racial and some of the discrimination is immigrant versus non-immigrant.
Yeah.
So it would be interesting to disentangle, and some of it, some barriers might be, even in your questions, might be economic more than, policing.
Yeah.
Can you just repeat the question?
Oh, so for the Zoom, so the question is if we considered finding doing a comparative sample with low-income whites or Blacks, and sort of to try to disentangle a little bit the sort of economic stratification that's at play here, not just the citizenship or immigration related. I think that's a really a great idea. I just received an NIH grant to do some of this work looking specifically in rural communities, and that will be a sample that includes US born and foreign born, but exclusively Latinos. But within that, we are very much thinking about the economic aspect and trying to include ways in terms of being able to do analyses to think about that economic differences between immigrants and foreign born populations, but exclusively within a Latino population. So I think the idea of thinking about other race ethnic groups is fantastic. But so if anyone, one thing too is I think as we develop sort of these measures, we want people to use them. So.
Great talk, thank you. So I have sort of a question that's two parts. The first part is, have you looked at what predicts membership into a class? So is it
Yes.
all the young people in one group? Is it Asians in one group? So
Yeah.
that, and then the second part of that question is did you ever think about the question in reverse? Like, is health a predictor of being a member of a particular class? So the reverse.
Interesting. So the great thing about the BCH method, it sort of simultaneously and I work with a statistician on this, so I'm not an expert, but simultaneously recalculates the classes and sort of holds those steady, includes the covariates into the estimates, but then also produces coefficients, sort of the estimate of how each covariate, kind of characteristics of each covariate are associated with class membership. And what we've found with that, and I didn't include it here, but I'm so glad you asked, is essentially race ethnicity is the largest predictor of class membership. So overall, for all of the classes, compared to the no exclusion class, Latinos are more likely to be in any one of the classes compared to Asian respondents.
Do you have other things like?
Yes,
Like household structure?
Yeah, we
or
included, so we
age?
included we have their citizenship, which surprisingly was not a predictor. We use FPL, and we use, because California uses 200% FPL, was not a predictor. And then we also included, because of the healthcare access measures, we included things like insurance, and we included like controlled for usual source of care in the delay models, and those weren't predictors. And so sort of, I think, driven by really differences in patterns between the two groups.
That's really interesting because it speaks to how like certain racial groups are kind of, and ethnic groups are kind of racialized to be considered immigrants, and why they might face different exclusions. I just keep thinking of the law enforcement variable, and like if we were to look at Afro-Latinos, what would that look like? It might not be directly immigration, but it might be more racialized police action on them. So they're so open to a bunch of intersectionality work here. So great, phenomenal work.
Yeah, and actually, so I'll just pull up this. So this is the law enforcement measures broken down by Asian and Latino. And I think a couple things, right? I think that I always highlight when I share this, and I'm often hesitant to sort of jump into differences because I think we can overly essentialize the two groups and sort of not think about the overarching structures that both groups are kind of contending with. But like overall, it's 44% of Latinos who know someone who's deported. However, for Asians, it's about 12%. And that is not something data that we've really had previously, and it's not small. And so I think kind of thinking about overall the just the enforcement system disproportionately is affecting Latinos, and we know that from the deportation numbers. But this is not a small magnitude for thinking about population impacts. So yeah, and there's some other kind of patterns that are interesting. I'll leave that up.
So a theme of our talks this semester has been policy variation and causal inference. You're working in California. Are there variations in the way localities do things that you're planning to take advantage of to try to do some causal inference, or is California fairly homogenous in the policy?
Not homogenous at all. And I don't do causal inference work, so I'm nothing that I'm doing is sort of driving. My hope is more to establish some ideas so that those of you who do the causal stuff can run with it. But absolutely. So I have another project that we actually developed indicators of county level policy context, which is challenging because counties don't actually have that much power over immigration related measures, but we established sort of a methodology for capturing the county level policy context, and have mapped it and done some preliminary analyses with ACS data looking at variations across the state. And absolutely, the counties are very different.
This is an example of the kind of difference that was.
Yeah, well, so the key thing that we found is that we have two indices that we've made. One is actual policy enactment. So we actually identified policies where counties have jurisdiction. And then the other is more of a social climate measure. So indicators of inequity, but that are sort of more reflections of deeper seated social differences. And what we found is a very clear pattern where some counties have quite a few proactive, inclusive policies in place. For example, having a health program for undocumented immigrants, having safe havens policies in schools, having improved sort of like labor protections for immigrants in their communities. And those counties are not the same counties that have strong, higher positive measures on the social climate. And so there's sort of this a little bit of a disconnect. So for example, Marin County, scores very high on the policy inclusive measure, but relatively low on the social inclusion measure. Yeah, and this gets at sort of, I think, the complexities of policies. Are we talking again about sort of that climate? Or are we thinking about the specificity of what the laws and regulations are doing?
Okay, on that note, thanks so much.
Thank you all so much.